I'm Dr. Sridhar. I'm a consultant neonatologist and currently I work at Alain Mediclinic. Very important concern in babies is neonatal jaundice. Again, I have detailed videos on neonatal jaundice, but from a parenting perspective, the most important thing is to know that the jaundice is a normal progression. The baby has excess hemoglobin while within the tummy, and after the baby is born, this excess hemoglobin gets destroyed, and the yellow pigment called bilirubin is a result of that. We monitor all babies for jaundice because there are some babies at higher risk. For example, if your blood group is O and the baby is AB or AB, or if you have antibodies against the baby's group in your blood, the baby has a tendency to excess jaundice. Premature babies have risk of jaundice, and we have age-appropriate charts which guide us on the treatment. So the nurses will check the jaundice usually with the skin test. We refer to the charts according to the age of the baby and decide on the treatment. A baby born at 36 or 37 weeks has a much lower treatment threshold compared to more mature babies born after 38 weeks. So the longer the pregnancy progresses, the more mature the baby is, the quicker they feed. So for any reason you discuss delivering at 37 weeks, try to wait longer as far as you can. And even the IQ has been shown to be better in the more mature babies. So if you have an emergency and you need to deliver at 37 weeks, it's fine. But if there is something else you prefer to deliver early, you try to postpone it, discuss with your doctor. So the jaundice is usually checked before you go home, so we know when the baby needs to come back. There is a threshold for the visit. If it's high, we need to come back even the next day or within 2 days and so on. And once we see you in the clinic, again, we do the skin test, review the feeding, the weight pattern, and then if needed, we may do a blood test for the jaundice, and some babies may need to admit for what we call phototherapy. Don't be worried about it because this is natural, and unless the level is very high, it shouldn't affect the baby in any way. In the breastfeeding babies, the yellow color on the skin can persist for 3-4 weeks, and in some babies it can even last for 2 to 3 months. So this is quite normal as well. The doctor will be checking around 2 to 3 weeks for direct bilirubin, which is a component of the liver function, and the stool color should never be pale. Because a pale stool may also indicate a liver abnormality. Provided these are normal and the thyroid is normal on the newborn scan, you just continue breastfeeding. Even if the bilirubin is a little high, it doesn't matter. You can refer my videos on breast milk jaundice, which is explaining this in more detail. But if you are breastfeeding, try not to stop breastfeeding just because the jaundice is on the higher side, unless it's absolutely essential.